Hello, my name is Mace, and I'm a volunteer counselor with SHINE, which is an acronym for Servicing Health Insurance Needs of Elders. And on behalf of myself, SHINE, Elder Source, and the Department of Elder Affairs, we welcome you to today's presentation of financial assistance for Medicare beneficiaries. Online meeting etiquette. Please familiarize yourself with the Zoom menu options. Please hold any questions, and with time permitting, I'll be glad to answer them for you at the end of the presentation. Friendly reminder. Please speak clearly and avoid using inappropriate language. Maintain a polite and respectful tone. Thank you. Elder Affairs. SHINE is a program of the Florida Department of Elder Affairs, DOEA. The SHINE program is part of the nationwide State Health Insurance Assistance Programs, SHIP. There are SHIP programs in all 50 states and 4 U.S. territories. The Florida Department of Elder Affairs receives annual funding for the SHINE program from a federal SHIP grant. The Florida Department of Elder Affairs vision is for all Floridians to live well and age well. SHINE's mission is to provide free and unbiased health insurance counseling through a dedicated network of volunteers, empowering Florida seniors to make informed health care choices. Disclaimer. SHINE is a free program offered by the Florida Department of Elder Affairs in partnership with your local Aging and Disability Resource Center. Specially trained volunteers can assist you with your Medicare, Medicaid, and health insurance questions by providing one-on-one counseling and information. SHINE services are free, unbiased, and confidential. SHINE is not affiliated with and does not endorse any insurance company or product. Area Agency on Aging, AAA. The Department of Elder Affairs administers programs and services for elders through contract agreements with the 11 Areas Agencies on Aging, AAA, in Florida. The AAAs are independent, not-for-profit organizations responsible for ensuring the availability of services to all elders in Florida. The SHINE program contracts annually with the Aging and Disability Resource Centers to provide counseling services locally. SHINE counselors. The primary duty of volunteer SHINE counselors is to help Florida seniors identify, understand, compare, and/or enroll in original Medicare, Medicare Advantage plans, Medicare prescription drug coverage, Medicare supplement insurance, Medigap, low-income subsidy, extra help for prescription drugs, Medicare savings programs. SHINE counselors also provide counseling for long-term care planning and assist clients with Medicare complaints and appeals. Through the SMP grant, SHINE counselors can provide education on Medicare fraud and abuse, including how to prevent yourself from fraud, how to detect fraud, and how to report fraud. SHINE handout. Many of you are here today because you would like to save on the out-of-pocket cost of Medicare and prescription drugs. Here is an example of the financial assistance for Medicare beneficiaries handout that can be obtained by calling your local SHINE office. We will discuss 2 cost savings programs known as Medicare Savings Program and the Extra Help Program. Medicare Savings Programs. Medicare Savings Programs, MSPs. The Medicare saving programs are designed to have individual states pay for eligible Medicare beneficiary out-of-pocket cost. The programs are jointly funded through state and federal finances. There are several benefit levels in the program that are based on individuals' income and resources. We will review these levels in a moment. Application assistance is available at the state level through the Department of Children and Families, DCF. Limited benefits are based on eligibility and include Medicare Part A and Part B premiums, deductibles, coinsurances, and co-payments. MSP's income and resources. Eligibility is based on an individual's income is at or below 135% of the federal poverty limit. This limit is subject to change each year. Income includes all income and wages, all benefits received, any pensions or annuities you may have, alimony payments, and any other contributions. Resources would be items such as, but not limited to, bank accounts and any cash you have on hand, stocks, bonds, mutual funds, IRAs, additional real estate you may have, and the cash value of the life insurance policies over $2,500. Extra help. Extra help. The Extra Help Program, also known as the Low Income Subsidy, LIS, is designed to help eligible Medicare beneficiaries with the cost of prescription drugs only. It is administered by the Social Security Administration, and like the Medicare Savings Program, eligibility is determined by certain income and resource standards. We will take a look at these standards in a moment. Individuals who apply for and are approved for extra help will have the opportunity to change plans one time per calendar quarter for the first 3 quarters of the year. Extra help benefits in 2025. The benefits of the lowest two levels include no monthly premiums or deductibles and minimal co-payments for each medication. The highest two levels provide benefits that include premiums that are reduced or at no cost, a reduced deductible where you pay a percentage, and a percentage of the co-payments for each medication. Medicare fraud and abuse. The following slides present an introduction to Medicare fraud and abuse. Medicare fraud and abuse. Fraud is purposeful. Abuse is a mistake. Medicare fraud and abuse. The difference between fraud and abuse is intent. Now let's learn the 3 most important steps that will prevent you from becoming a victim of Medicare fraud and abuse. 3 steps to prevent healthcare fraud. So what can you do to take charge and help prevent Medicare fraud, errors, and abuse? 1. Consider ways to protect yourself and others from becoming Medicare fraud victims. 2. Detect Medicare fraud and abuse. Even when you do everything right, there is a chance that you could be a target of healthcare fraud. 3. If you detect or suspect fraud or abuse, report it. You will protect other people from becoming victims and help to save your Medicare benefits. 3 steps to prevent healthcare fraud. Here are some tips to protect yourself from healthcare fraud. Treat your Medicare card like you would a credit card. Only share Medicare cards and numbers with trusted sources who need that information to serve you, i.e., doctors and pharmacies. Do not rely on advice or offers from unknown persons who call, visit, or approach you in public. Never sign a blank medical or insurance form. Detect. Medicare sends you two notices with your claim information. The two notices are the following: Medicare Summary Notice, MSN, and Explanation of Benefits, EOB. These notices allow you to review your Medicare claims and check for possible mistakes. Report. If you see something unusual on your MSN, check with your plan or call Shine. If you get a call from someone requesting your Medicare number, do not give it out. Call the Federal Trade Commission at 877-382-4357 and your local law enforcement. If you believe you're a victim of fraud or abuse, contact your local law enforcement and Shine for more information. Prevent. Medicare loses approximately $60 billion each year due to fraud, errors, and abuse. Due to these losses, CMS has developed a new Medicare card. The card replaces your Social Security number with a Medicare beneficiary identification number. There are still opportunities for fraud and abuse if a fraudulent party has the new card. The new card is sent to an unfamiliar address and used by a fraudulent party, or if personal information, such as a Social Security number or bank account numbers, is shared with a fraudulent party. Prevent. Treat your Medicare card as you would a credit card. Share Medicare cards and numbers only with trusted resources who need that information to provide services to you, i.e., doctors, pharmacies, etc. Don't rely on advice or offers from strangers who call, visit, or approach you in public. Never sign blank medical or insurance forms. Detect. There are two notifications that you can receive from Medicare. One is the Medicare Summary Notice, MSN, and the other is the Explanation of Benefits, EOB. Both notifications should be reviewed to verify that they do not have errors. Your MSN is sent by Medicare every 3 months. You may choose to receive Medicare Summary Notices electronically, EMSNs. If you choose this option, you will receive a monthly email with a link to your claims information. You must be receiving monthly EOCs from your prescription drug plan and or your Medicare Advantage plan. Report. If you see anything unusual on your MSN, check with your plan or contact Shine. If you receive a call from someone asking for your Medicare number, don't disclose it. Call the Federal Trade Commission at 877-382-4357 and local authorities. If you believe you're a victim of fraud or abuse, contact local authorities and Shine for more information. SMP, red flags on an MSN. Your Medicare Summary Notice, or MSN, is very useful for detecting fraud. Let's review the 5 highlighted sections that will help you check for fraudulent Medicare charges. 1. Your visit. This section provides information like the date you went to your doctor. Keep your bills and compare them to your notice to be sure you got all the services listed. 2. Service descriptions. User-friendly service descriptions will make it easier for you to know what you were treated for. 3. Approved column. This column lets you know if your claim was approved or denied. 4. Max you may be billed. This is the total amount the provider is able to bill you. It's highlighted and in bold for easy reading. 5. Notes. This section refers to explanations of your service as listed at the bottom of the page. Next, let's look at the sections highlighted in red for examples of what to specifically check for. Is this a provider you know? Did you receive services on this day? If you live in Connecticut, did you really receive services in Ohio? Do any services appear twice when they shouldn't? Questions or comments? Please hold any questions or comments until the end of the presentation, and with time permitting, I'll be glad to answer them for you. Shine. Shine counselors offer free and unbiased assistance to help seniors identify, understand, compare, and/or enroll in Original Medicare, Medicare Advantage plans, Medicare prescription drug coverage, Medicare supplement insurance policies, Medigap, Medicare prescription drug low income subsidy, Extra Help, Medicare savings programs, long-term care planning, insurance and financing, other public and private health insurance. Contact the local Shine program. Elder Source. The local PSA 4 contact in Jacksonville, Florida is Elder Source, located at 10688 Old St. Augustine Road, Jacksonville, Florida 32257. The phone number is 888-242-4464. Tell us how we are doing. Please complete a short survey at the URL listed here, tinyurl.com/survey for Shine, and tell us how we are doing. End of presentation. Lastly, on behalf of myself, Shine, Elder Source, and the Department of Elder Affairs, we appreciate your time and participation in today's presentation. We hope that this presentation has provided an insight into becoming educated and better assist you with your Medicare endeavors. Thank you.